Howdy to my colleagues and good friends at the Texas Medical Association. I bring warm greetings on behalf of everyone at the AMA, and thanks to the many Texans who contribute to the work of our organization. The speaker didn't give me time to name them all, but that's okay. I've been there. I know this is a very difficult time for everyone, for physicians, for nurses, and for the communities we're privileged to serve. The AMA, like the TMA, has been engaged in the COVID-19 pandemic response effort from the beginning, developing trusted resources for physicians and pushing Congress and the administration to get you the PPE and financial support you need to withstand the tremendous economic pressures so many independent practices are facing. But the AMA also has an aggressive advocacy agenda outside of COVID-19, including our work with many states to protect physicians from scope of practice expansions and support physician-led teams. Unfortunately, non-physician groups have seized upon concerns over workforce capacity during this pandemic to expand their scope of practice. The AMA has pushed back with you and has sought ways to bolster the physician workforce by expanding telehealth, encouraging retired or inactive physicians to return to the workforce as appropriate, fighting prohibitive immigration restrictions, and supporting civil immunity protections. The AMA has helped secure at least 11 legislative victories in 7 states just this year to halt scope expansions. And we've made it clear to state and federal lawmakers that now is not the time for broad scope expansions. Any measures to relax existing scopes of practice must be temporary and narrowly tailored to caring for COVID patients. The AMA is focused on removing obstacles that interfere with patient care, especially in this health crisis. That's why we've called on state and federal policymakers, as well as private payers, to ease unnecessary administrative burdens, such as prior authorization, audits, data requests, and quality reporting, and why we successfully pushed CMS not to penalize us for failing to complete MIPS reporting last spring. I even spoke with the CEO of the ABMS last week to discuss how continuing certification programs add to the physician's burden. AMA applauds states who've removed burdens related to COVID-19 care. To date, 14 states have eased administrative barriers, such as prior auth and step therapy for COVID-19 care, and dozens of states have removed prior authorization for testing. In response to COVID-19, we've seen widespread adoption and expansion of telehealth across the country. AMA's model bill on telehealth, completed in 2017, continues to provide guidance to state lawmakers, regulators, and other policymakers, and has helped lay the groundwork for the expansion efforts we're seeing in this pandemic. We are proud that TMA is working with us, the Physicians Foundation, and others in the National Telehealth Initiative to support greater implementation of telehealth through education and the sharing of resources and best practices. As the COVID-19 pandemic continues to spread and infections rise, it is clear that our work is far from over. The AMA remains committed to advising Congress on the severity of physician practice financial loss during the pandemic and ways to aid physician practices in the upcoming COVID response legislative packages, pressing for the continuation of temporary telehealth provisions that enable better patient care, greater alignment of telehealth coverage, payment, and coding policies across all payers, and the continued suspension of further regulatory hurdles. Urging Congress to protect and expand high-quality, affordable health care coverage during this unemployment crisis, including additional funding for Medicaid, and to not add poorly conceived surprise billing legislation inappropriately to pandemic response packages. Continuing to work with private insurers to mirror the new Medicare telehealth flexibilities in the commercial markets, and call on employers with self-funded plans to do the same. And calling on federal and state leaders to rely on science when considering reopening businesses, schools, and when relaxing or reissuing stay-at-home orders. I'm so proud of how the AMA and TMA have stood behind and worked for physicians in this very challenging time. We still have a long way to go, but physicians know we have their backs and that we're always going to be out there fighting for them and for our patients. Thank you, and best wishes for a successful virtual meeting.